Breaking your nose and a finger would be pretty painful, but given the choice between that and hepatitis C, you'd probably choose the former. Allison Beck has lived through both. She is one of more than 50,000 New Zealanders who have contracted the hepatitis C virus. Potentially there are many more, as it is estimated only half of cases are currently diagnosed. Beck is luckier than some. She managed to beat the virus after taking a course of interferon. Today she is angry, not just because her friends have died from hepatitis C, but because she feels those responsible are not fronting up.
There is a group called the South Island Alliance, and they were tasked by the Ministry of Health, I think at the end of last year, so the end of 2015, to ensure that DHBs in the South Island were prepared to deal with what they're now calling a hepatitis C epidemic.
General Manager of South Island Alliance, Jan Barber, told the South today in response to these comments that the Ministry of Health was given funding to support the DHBs working together, and the contracts were in place prior to the Alliance's involvement. She said patients would still get services, but who delivered them was at the discretion of the District Health Board. Beck's organisation provides advocacy and support, but doesn't offer clinical help.
Over a period of this year, I've been working with patients and clients all around New Zealand. The Auckland District Health Board, they've been writing prescriptions and monitoring payments at no cost to the patient, making sure that the patient is well managed and safe during treatment. Wellington are doing it, Christchurch are doing it, and yet Dunedin, who started this whole thing with the generics, they will not do it.
The Southern DHB told the Otago Daily Times they did not wish to take responsibility or accountability for prescribing such drugs. Beck says the South Island Alliance has not contacted her since she was told her services were no longer needed.
I'm staff, my management and board are based in Christchurch. I haven't been able to contact them this week, but I have just sent an email saying, hey, do you know what is going on? It would be nice to know. I have no idea what monies are left in the bank. I have no idea when the job will be over. I honestly just do not know.
She says over 300 patients will be left out in the cold when the service closes.
It means if we're not here, people will just die. It's really that simple, and we're losing more and more people each year to Hep C in New Zealand.
And it's affected many lives, especially in the creative community.
This was him at the beginning of last year, over in, I think he was in Samoa with a good friend of his visiting her family. At that stage he knew that his Hep C was causing massive problems for his liver.
With the recent parliamentary reshuffle and the potential changing of the guard in the cabinet, Beck says it is the responsibility of the Health Minister first and foremost to deal with an issue that has confronted a generation of Dunedin artists. Roselle LeBone, The South Today.